Hello, my name is Tracy G. Today I am doing my final video presentation for Intro into Healthcare Systems at eVarsity. So, we are going to look at the ambulatory healthcare system, since in week one we were asked to visit and write uh, an essay over a system that we visited, and I chose the ambulatory healthcare system of University of Arkansas for Medical Sciences Regional Program South Central, which is a family practice clinic here in Pine Bluff, Arkansas. Now I'm going to break uh, this down into different aspects to look at within the clinic itself and also at ambulatory healthcare systems, period. Um, the first is going to be historically, the second is going to be economically, then we're going to go to politically, also to administratively, and functionally. So let's go to historically. Ambulatory healthcare systems are considered to be a measure of access to appropriate primary health care, including preventative and disease management services. This is resulting in better health care outcomes, reduce health disparities, and lower spending, including avoidable emergency room visits and hospital care. Although 50 years ago, roughly half of the physicians in America practiced primary care, today fewer than one-third of them do. This involves the widest scope of healthcare, including all ages of patients, also all patients of different socioeconomic and geographic origins, patients seeking to maintain optimum health. In the introduction class to healthcare system, there is we went over some of the history of all medical practitioners. That is said in the 1800s, it was more of a technical trade. Now, however, today the ambulatory clinics are equipped with medical practitioners that have studied at least 7 years for their medical doctrine. Also in the introduction class, we learned that the primary care clinic was not heard of during that, like the 1800s time. And in fact, the home care was more effective until the Industrial Revolution of the 19th century, when the medical community stepped out of the Dark Ages, per se. Now, the Clinic of UAMS South Central is a learning center for resident physicians, and they provide optimum care with research of disease and disease processes as the leading focus. Since they are a learning facility, the resident physicians there will make their own hypotheses or diagnosis of the treatment or of the disease, and they have to report back to their faculty doctor on staff to develop a plan for treatment. So instead of necessarily seeing one physician, you may be seeing a group of physicians. Now I would like to move on to economically. In the United States, we lag behind other developed countries in both population health and healthcare system performance, partly as a result of decade-long decline in primary care, which I talked about earlier. However, as people live longer, chronic disease increases, and the frequency of patient visit increases as well. The access to healthcare insurance is allowing more people to attend primary care clinics, such as the Affordable Care Act. Now more people have access to insurance who didn't have before. Um, this should show an increase in primary care usage and a rise in the economic economy of healthcare. Sorry about that. Now, also, there is technology growth, abetted by specialist-oriented workforce and financing policy, has become the leading cause of high U.S. health spending. So the U.S. spends more on technology and equipment, and perhaps even the development of drugs for their patients. The clinic here at UAMS South Central is economically growing and advancing in the community as a reliable primary care clinic. Out of the payment methods we have studied, our clinic runs on the fee-for-services system. It's a payment model where services are unbundled and paid for separately, whereas per capitation is per patient and not for each services provided to the patient. The area in which the clinic is located is rural and has one hospital system, the Jefferson Regional Medical Center, for the region, allowing for economic growth within the clinic to utilize the hospital system. The clinic has minor technology compared to the main hospital, UAMS in Little Rock. We do use the equipment at Jefferson Regional Medical Center, but compared to the clinics in Little Rock, our clinic is less developed in technology due to the fact that it's a smaller clinic, yet we do have a wide range of patients. So we utilize JRMC for outpatient services such as mammograms, CTs, MRIs, things of that nature. Now we do perform procedures in-house at UAMS, such as wound care or removal of moles and things of that nature, small office procedures. But anything big, we will go to JRMC to perform as well. Now, politically, primary care, although modestly expanding ancillary services, remained focused on ambulatory visits. So there has been a recent willingness of the major primary care to unite in effort to highlight the patient-centered medical home, which PCMH, which is a model of care that emphasizes care coordination and communication. Medical home can lead to higher quality and lower costs, and can improve patients' and providers' experience of care. In class, we have learned of diversity within the healthcare system. UAMS has one of the most diverse clinics in the region. Since we are a learning facility, the physicians are of both genders, various races and nationalities. There's a greater diversity in the healthcare workforce that might increase trust in the healthcare delivery system. So, for example, say I am a young Asian female in this country, and I speak English, but not very well. So, I would want to go to a provider that I feel more comfortable with. So, if you could find somebody of your nationality and your home language, you would more than likely choose that person to be your provider for your health care. We at UAMS South Central have those options for a lot of the minorities in our region. Now, the patient-centered medical home is also in practice at UAMS South Central, with a coordinator designed specifically to develop plans, projects, and so forth for better health literacy within the patient community. The one we have at our clinic is often bringing up brochures and giving out surveys to be completed by the patients so she can collect data and place new policies where we're better equipped to serve our patient health literacy. Now, we're going to move on to administratively. There are a board of directors that are a governing body, and they're based on the same logic as one between patients and doctors, which is there's 3 stages of discussion. The first is understanding symptoms, the second is diagnosis, the third is treatment. Now, the board must operate under these specific stages of discussion, and also be responsible for mission, values, goals, strategic priorities, performance assessment, the fiscal and legal oversight of risk management, the CEO selection and evaluation, community relations, resource development, management systems, and board system management. It's a lot. Now, the roles for the board include decision making, advisor, and implementer. We're going to continue on with administratively. There are types of boards, specifically 3: the working board, the governance only board, and the mixed module board. Now, UMS South Central operates with the mixed module board, since for the most part they keep involvement limited to matters of policy and strategy, while managers handle most of the operating decisions for day-to-day. Now, the board does come down and do walkthroughs and review the clinic, and take a little part in different operation developments that they want, but for the most part they speak with the managers and directors of the clinic. Now, since UMS South Central operates at a different location than the board members, it is more effective that they have the mixed module board. Now, when the board is still connected to the manager, staff, volunteers, and stakeholders, but perhaps on a different level than at the home facility. At the home facility, they may be more of a working board than they are with our clinic, because we are, so distant from them. Now, I'm going to move on to the second, to functionally. Healthcare systems function on a strategic plan consisting of values, mission, values, vision, environmental content of operations, internal capacity, goals, and priorities, prioritization, implementation, and accountability. So, if we move on to functionally, I'm going to read a little bit of the 2020 UMS strategic plan. The actual plan itself was 36 pages long. I just kind of took the gist of it and would like to touch base on some of what they have in their strategic plan to give you an idea of what a strategic plan is and may consist of. So the first is with an aging population of baby boomers, many whom have chronic diseases combined with new financing through healthcare reform, demand for healthcare services will increase dramatically. The supply of primary care physicians in Arkansas is inadequate to maintain current access and healthcare delivery models. New healthcare models must emerge, including more preventative care access and more healthcare teams, which will include advanced practicing nurses, physician assistants, and other types of healthcare professionals. UMS can play a leadership role in meeting health workforce needs. The patient-centered medical home modules will become more prevalent, and a care framework that follows the patient rather than focusing on acute care episodes in clinical settings. Distant technology will increase to provide specialized medical expertise in rural areas. educational programs, and assistance for chronic disease management in patient homes. Fee-for-service payments will enhance compensation I can't pronounce that, by providing more units of service will likely change. Both payments per patient per health care episode will decrease, with new strategies for aligning financial incentives to reward outcomes and efficiencies in service deliveries will emerge. These new modules will probably include bundled payments and pay for performance and will encourage accountability for population health management. These changes will lead to more focus on quality and efficiency rather than volume growth and financial viability for healthcare systems. There will be an increase in transparency and mandatory public reporting of healthcare quality measures. These measures will be used in determining payment to healthcare systems by public and private payment systems. Integration of healthcare system will increase with health information networks, telemedicine linking urban and rural health providers and systems, new partnerships among healthcare systems and funders, and translation research linking investigation and healthcare practices. Advances in biomolecular research and diagnostic will lead to more tailored, personalized therapies and personal risk assessment. Some of these things I have addressed in our previous talks as well, but it's nice to see that they're actually included in the strategic plan for UMS. Now, that covers all the topics that I wanted to get with you about today. So I would like to do a conclusion. The Intro into Healthcare Systems class has gave me the foundation for which I need to build my future degree on. Along with the experience of healthcare workforce from being employed in the healthcare for 7 years and my continued educational studies, the SMART objectives I have set for myself are completely obtainable. Now, the SMART objectives are something that is specific, measurable, achievable, realistic, and time-bound. I have made 3 for myself. The first, that within 3 years to have completed my studies on eVarsity and graduate with my Bachelor's of Health Information Management. Next, for a 5-year objective, I will have a billing manager position with the clinic I am currently employed and have raised the reimbursement for the clinic by 15% within my first 2 years. 10 years, my third goal is that within 10 years from now, I will be the clinic director and have completed or have the clinic operations at a 20% increase in satisfaction among the patients there at the clinic. So that concludes my introduction to healthcare final video. Thank you for the class, thank you for the education, thank you for the information, and be blessed.